Good evening. It was just a little over 10 days ago we were all shaking our heads at news that Italy was locking down the entire country to stop the spread of COVID 19. Awful, we thought, but it couldn't happen here. Except it slowly is. State by state, residents now being ordered to stay indoors. Non essential businesses told to close. The latest, Connecticut, as the wave of sickness appears to be following the grim predictions. Again, tonight, our team is going to explore the facts, the ramifications, and what our leaders are doing to protect us. We start with Miguel Almaguer.
Tonight, the governors of New York, California, Illinois, and Connecticut taking drastic and historic action. Residents of multiple states told to go home and stay home as the coronavirus crisis explodes across the nation, affecting at least 76 million people. The orders, which if violated could include a civil fine, means all non-essential businesses must close, while places like grocery stores, gas stations, and mass transit continue to operate. Going out to pick up food or supplies or solitary exercise like a walk or hike are permitted.
And when I talk about the most
Okay, so this is martial law. All right? Locking down cities, limiting the rights, the civil liberties of people, which they're claiming is 76 million at this point around the world, or no, Americans alone, are being told to stay home or being given curfews, told when they can and can't be out of their homes. The president is usurping more and more powers to be able to do this, and also the states themselves, these governors are coming down and saying, hey, we're telling you to stay home because the guise of a pandemic continuing to spread. So this is the game at play here. Let's continue on.
drastic action we can take, this is the most drastic action we can take.
As the number of confirmed cases skyrockets in New York, in California, the most populated state in the nation, they have doubled. In a letter to Congress, Gavin Newsom is requesting $1 billion to fight the virus and asking for the USNS Mercy, a floating hospital, to dock in Los Angeles.
This is a moment where we need some straight talk, and we need to tell people the truth. We need to bend the curve in the state of California.
With California bracing for 20% of those infected with the coronavirus to be hospitalized, in Washington state, where the death toll is the highest, officials say they are preparing to ration health care, including ventilators.
The notion that this could happen in America, where we can see something coming and we can't get the resources here to avert it, is ridiculous. It should not happen.
In uncharted territory.
Okay, and now here we come with a moral dilemma presented, right? So what is happening is they're saying so many people are going to catch this disease that there won't be enough medical equipment to help save everyone's life. There won't be enough ventilators to put enough people on. So that causes a lot of fear amongst people. And because of that fear, you can put forth certain actions, hence martial law actions, curfews, and taking away of civil liberties. You can implement that when people are in mass fear. I mean, we've seen this back from the 9/11 event. It's not a per se new idea, but the way in which the idea is being played out is not one of terrorism, but of a pandemic. So let's continue.
Today, the U.S. government extended the federal tax deadline 90 days, the first time in history, hoping to ease the financial burden on all Americans. With both the Mexican and Canadian borders closing to non-essential travel, the CDC is worried Border Patrol agents face a serious risk of becoming infected. The crackdown on large groups spreading coast to coast. Orange County, Florida, which includes Orlando, will have a curfew beginning tonight. Kerry Sanders is across.
And this is a news broadcast from March 20th, 2020. I live in Florida, actually a county right outside of Orange County. And they're saying now Orange County, starting on March 20th, 2020, from 10 p.m. to 5 a.m., they'll have a curfew. So they cannot leave their house for quote-unquote non-essential reasons. It's taking away from someone's freedom of movement. It's a human right. Okay, so let's keep that in mind.
The state. The conflicted images of states like California that are shut down, while here in Clearwater, Florida, spring break continues, has finally hit a breaking point. This beach will close down tonight, and already some college kids seem to be getting the message, packing up, heading home. Just 4 months away from the Tokyo Olympics, USA Swimming is now officially calling for a one-year postponement of the Games. Facing a new reality, tonight we are all reminded of what's at stake. This, the changing face of a nation, perhaps more connected than we are apart.
The U.S. Olympic Committee says it's premature to make a decision about the Summer Games. As for that go-home order here in California, it's open-ended, but the mayor of Los Angeles says it could last upwards of 2 months. Lester?
All right, Miguel, thank you. And at the nation's hospitals tonight, a worsening situation as doctors and nurses try to save lives, increasingly without the protective gear and equipment they need. Tom Costello has the latest.
The warning from the nation's frontline ER doctors, the situation is critical.
What we're dealing with right now is something most of us in our careers have never seen, which is a slow roll mass casualty incident.
With doctors and nurses running low, and now...
Why does she find it funny that this will be a slow roll mass casualty event? Okay, I'm not sure why she laughed there. I don't know if it was a nervous thing or what that's about, but I don't think it's funny one way or another if you're seeing people dying in front of you.
Reusing personal protective equipment, communities are stepping up and making masks. New York City is warning it will run out within 2 weeks. UMass Medical near Boston says it's a matter of days.
Right now, our number one priority is getting those N95 masks, and the gowns will be number two. Gloves and eye shields will be right behind it as well.
Also in high demand, ventilators for the most critically ill patients.
We need those ventilators. The ventilators are to this war what missiles were to World War II.
Wow. And listen to this. Drawing parallels between this and a war. In terms of equipment needed, strategy, putting orders in place and taking away civil liberties. That's very important to pay attention to the rhetoric that they're using.
Hospitals have roughly 160,000 ventilators, but doctors warn they may need as many as 960,000 in a worst-case scenario. Columbia medicine surgeon Cornelia Greggs wrote a New York Times op-ed warning the sky is falling.
It feels like living in a terrifying sci-fi movie, but this is real life.
Again, a person smiling. I don't
in the
understand
United
that.
States, our hospitals, at least in New York, are going to start to look like Italy's hospitals.
The president today announced an automaker is offering to produce ventilators.
One company that has openly stated it is General Motors.
Ford tells NBC News it's also offered to help. And 3M says it's now making 400 million N95 respirators a year. Meanwhile, continued frustration over testing for the virus.
They said, oh, you got to go to the hospital. But then again, they tell you to stay away from the hospital.
Based on data collected from state health departments, NBC News calculates more than 117,000 COVID-19 tests have now been completed, as most states struggle to meet demand. A newly opened site in Paramus, New Jersey today filled to capacity and forced to close within 4 hours. While on the front lines, doctors are already battling to save lives.
There's a lot of anxiety. There's a lot of fear. There's a lot of wondering if you're risking your life by going to work. But we're feeling, abandoned. We're feeling isolated.
With supplies and medicine running low, hospitals are now preparing to make terrible decisions about which patient has a better chance of survival and which patient may be denied the care they need. Lester?
Yeah, Tom, this is so troubling. These are the people we absolutely need. Thank you. The devastating and deepening impact on business pushed the markets down again today. The Dow tumbling more than 900 points to end Wall Street's worst week since '08. Gabe Gutierrez now in the sudden and stack.
Simultaneously, as a worldwide virus is spreading, you're also seeing the decline of economies. The fall of the business sector. So that creates a whole additional hardship at the same time. So it's not just one event so much. It's almost like simultaneous events all merging to create the reality that we're living in now. We'll see as this goes along the different manifestations that can arise and may arise from what we're currently living through.
During rising unemployment.
It's become a daily ritual. Newly unemployed hospitality workers are coming to Hook Hall in Washington, D.C. Coronavirus forced this bar to close. Now, with donated supplies, volunteer chefs are feeding those who are out of work from around the area.
It's jarring. It's so jarring to see the number of people come through the door.
Yesterday, the Labor Department said last week's nationwide unemployment claims were up dramatically. Tonight, an even bleaker picture from individual states. In South Carolina, unemployment claims this week have shot up at least 400%. Colorado, 875%. Oregon, more than 2,100% in just 2 days.
This is just the tip of the iceberg because it's only a couple of days and it's only 21 states. It could be as many.
And I don't care what you think about the government, you cannot maintain a flourishing so-called economy by just pumping out endless amounts of money. See, this is what the banks have been doing. This is what happened back in 2008 when the banks, fractional reserve system led to banks writing loans in which they had no money to really actually back it up, no actual value. It was just value be created on a computer, numbers on a screen. So that's the way they prop the economies, but that's not long term. You can never try and account for something that's not really there. So what they're doing with this economy, all these people are applying for, government assistance, unemployment. It can't sustain itself. So let's continue.
Many as 2 million people
across the country.
I mean, it's a mess.
Workers like Lorenzo Landini of New York are complaining of jammed phone lines and crashing unemployment websites.
It's stressful. It's really stressful, and it's first time unemployed in my entire life since I was 16.
Bartender Beverly Barber got her last paycheck today.
You don't know where your next dollar is coming in from.
The owners of this bar say they've been forced to furlough dozens of their hourly workers. With no customers, they're doing what they can to serve each other. Lester?
All right, Gabe, thank you. Also breaking, that $1 trillion relief package that includes direct payments to Americans appears to be coming together, plus President Trump on whether we need a nationwide lockdown. Peter Alexander at the White House.
You to lock anybody down.
With strict new measures now being implemented in the hardest hit states like California and New York to slow the spread of the virus. Tonight, President Trump says a national lockdown is not needed.
We're working with the governors, and I don't think we'll ever find that necessary.
Lawmakers tonight are still hashing out an expected $1 trillion economic relief
package. First of all,
package.
I'll tell y'all something about Trump. Don't ever believe anything that comes out of his mouth, because he'll say something one day and then come back a few days later and say something else like it never happened. There's no accountability. They're going to do whatever they want. All right, so don't believe that it's not going to be a nationwide lockdown at some point.
Direct payments up to $1,200 possibly for many Americans. $500 per child.
There's tremendous spirit to get something done, so we'll see what happens.
It comes a day after the president touted the immediate delivery.
Here's what I want to say about the money, too. My question is, where is this money coming from that's going to support giving all this, what did they say, $1,200 back to American taxpayers? Why don't you not take the tax in the first place so that that person keeps all the money that they earned at the rate they were told they would earn at? You don't need to take money from people just to give it back. Leave people's money alone. Keep your hands off of it.
Drugs that have also shown promise treating coronavirus, but are still in clinical trials. and have not been approved for that use. Is it possible that your impulse to put a positive spin on things may be giving Americans a false sense of hope?
No, I don't think so.
Representing preparedness right now?
No, I don't think so. I think that, I think it's got,
The not yet approved drug.
Such a lovely question. Look, it may work and it may not work.
Wow.
I feel good about it. It's all it is. It's just a feeling. I'm a smart guy. I feel good about it.
What do you say to Americans who are watching you right now who are scared?
I say that you're a terrible reporter. That's what I say. Go ahead. I think it's a very nasty question, and I think it's a very bad signal that you're putting out to the American people. The American people are looking for answers, and they're looking for hope. And you're doing sensationalism.
We asked the vice president the same question later. What do you say to Americans right now who are watching and who are scared?
I would say do not be afraid, be vigilant. All the experts tell us that the risk of serious illness to the average American for the coronavirus is low.
And late tonight, the White House announced that a member of the vice president's staff...
Also, pay attention how, on one end, you're getting nothing but a fear propaganda piece just being pushed onto you. And on the other side, you have a control system being the current president of the United States, who's pushing a different message of, well, it's not such a big deal. There's a small section of the population who's even going to feel the effects of this, yet still putting in place measures, orders, because of his additional powers that magically arise during a time of pandemic. If you want to look into the documentation that supports these ideas, puts in place orders and actions to still take away the civil liberties when you say that it's not even that big of a deal. Now, I guess more so right now it's governors of particular states putting forth measures, but still the president has put travel restrictions, of taking away other liberties. So it's a control system that's basically, at this point, out of everything we've seen, the action that has been taken is taking away our civil liberties. So let's continue.
Has tested positive for coronavirus. The White House tonight says neither President Trump nor Vice President Pence had close contact with that individual. Lester?
All right, Peter, thank you. This crisis, this horror we're going through is perhaps too easily reduced into numbers. The number of tests, the numbers of infected, the number of dead. Allow me a moment to put just one face to those numbers, a face we here at NBC News know well, our colleague and friend Larry Edgeworth. We lost him to this virus last night, and we, like families everywhere who have suffered loss, are grieving. Larry was an audio engineer. He worked in the field covering stories all over the world. Larry and I logged some interesting times together in some interesting places. If Larry was your sound guy, you knew you were going to be fine, both technically and in every other way. A gentle giant, as one of our colleagues so aptly described him, who you knew had your back. Larry was a kind and generous man who always made us smile. Our heartfelt condolences to Larry's family and his many colleagues here at NBC. We are heartbroken. And there's so much more to tell you about tonight, including a staggering development of the epicenter of this crisis. We'll be back in just 60 seconds.
All right. So we're going to end it there. Just wanted to take a look and talk a little bit about the current state of affairs with this coronavirus so-called pandemic. My overall message is just pay attention. Don't believe everything you see or hear. Research for yourself. Don't buy into the fear. And just stay healthy, stay higher-minded, and continue to do what's best for you and your family and the people you love at this time. All right? I'll catch y'all next time. Y'all take it easy.